Christina, I'm going to be your nurse today. This is patient AW. Before you start an exam, you want to check the patient's name and date of birth with their wristband, which I have done. So I've done an extensive health history on this patient. He's a rather healthy young adult. He has no known allergies. He's currently not taking any medication. However, he does admit to smoking 1 pack of cigarettes daily. Before you start the exam, I'm going to wash my hands. I'm going to put on gloves and then I can begin. I took a complete set of vital signs on this patient, and I'm going to begin by inspecting his head and his scalp and also palpating. So I note no lesions noted. His hair is evenly distributed, no masses at this time. I'm going to have you raise your eyebrows to wrinkle your forehead, and I'm also going to have you close your eyes. Good. Can you puff out your cheeks? And clench your teeth together. Very good. Next, I'm going to begin by palpating your temporal artery. Good. And I'm going to palpate the TMJ joint while he opens and closes his mouth. Good. And I'm going to have you protrude your bottom jaw out and move it side to side. No clicking noted. Okay, I'm going to have you clench your teeth. And I'm going to place my hand on your lower jaw and try to open your mouth, but do not let me open your mouth. Good. He has strength equal on both sides of his mandible. Next, we're going to palpate his frontal sinuses and his maxillary sinuses. So let me know if you feel any tenderness or pain.
No.
Good. And next we're going to move on to the eyes. So we did a visual acuity test using the Snellen chart. Patient has 20/20 in the left eye as well as 20/20 in the right eye for 20/20 in both eye on this examination. We are going to test his confrontation. So I'm going to have you cover your right hand with your right eye. I'm going to cover my left eye and tell me how many fingers I'm holding up.
1, 2, 1, 1.
Good. And now I'll have you do the opposite eye. And I'll cover my right eye.
1, 2, 1, 1.
Good. Alright. Next, we're going to test his extraocular eye movements using the 6 cardinal positions of gaze. I'm going to have you look straight at my finger and follow it only with your eyes. Good. Okay. Next, I'm going to have you follow my finger with your eyes all the way in. Very good. And then I'm going to test his, I'm going to inspect his sclera, corneas, iris, and conjunctiva to make sure that there's no drainage. I'm going to pull down on your eye, on the bottom of your eyelids, look up. Good. And I'm going to pull up and look down. Good. So his sclera is white, no drainage noted, no signs of any irritation or redness. Alright, after I do that, I'm going to test your light response as well. So I want you to look straight ahead at the window in front of us, and I'm going to shine this light right in the middle. Good. Next, I'm going to shine the light on either side of your eye. Good. Good. So his eyes are equal, round, and reactive to light. And next we'll move on to your ears. Okay? So I'm going to have you turn your head to the left. I'm going to inspect the ear. No masses noted, no lesions noted, no drainage. I'm going to pull on the pinna, push in on the tragus. Does that hurt at all?
No.
Okay. I'll have you turn to the other side. Same thing. Pull on the pinna, push on the tragus. Any tenderness, any pain?
No.
Good. No drainage noted. We're going to do the whisper hearing test. Patient passed the whisper hearing test bilaterally at 5 feet. And now we're going to move on to your nose. I'm going to palpate your nose. No deformities noted. His nose is symmetrical with his face. I'm going to have you cover one nostril at a time, and I want you to breathe in and out in through your nose. So do one nostril. Good. So his nares are bilaterally patent. Next, we'll move on to your mouth. I'm going to have you open your mouth nice and wide. Say ah.
Ah.
Good job. Alright, so his buccal mucosa is pink and moist. There are no obvious lesions or deformities. I want you to, I'm going to do the gag reflex by taking a tongue depressor, sticking it to the back of his tongue, and that does elicit a gag reflex for him. I also want you to stick your tongue out. Good, and stick it up. Very good, and side to side. Very good. So no deformities on the tongue. The tongue's symmetrical in his mouth. Okay, so next we are going to move on to your neck. Okay, so there's no lesions noted, no masses noted on inspection of your neck. I am going to palpate your lymph nodes. So pre-auricular, post-auricular, occipital region. Good. I'm going to move down your neck. Very good. We're going to do the mandible region and the submental. Very good. After we do that, we're then going to palpate his carotid arteries. So, good. Good. Next, we're going to listen to, hopefully not listen to, a bruit of his carotid arteries. Bruit is a swishing noise. It is an abnormal finding that it exemplifies that there's artery narrowing. So we don't want to hear that on the examination. And we listen to it with the bell of our stethoscope. Good. There's no bruit noted. Next, I'm going to palpate the trachea. And I apologize, this is a little uncomfortable. Good. Trachea is midline and symmetrical. Next, I'm going to have you bend your neck down, your chin to your chest. Good. And then bend it all the way back. Extending it. Good. Bring it back. And turn it right and left. Very good. And then your ear to your shoulder and your ear to your other shoulder. Good. Now, what I'm going to have you do is I'm going to place my hand on this cheek. I want you to try to move your head to the left. Good. And now try to move your head to the right. Very good. And I'm going to have you shrug your shoulders while I push down on your shoulders. Good. Good, good, good. So his strength is equal bilaterally on both shoulders. Next, I'm going to move down. I'm going to actually palpate his thyroid gland. So I'm going to come to the back of you. I want you to tilt your head slightly to the right. Good. And I'm going to palpate your thyroid gland. Very good. Next, after that, I'm going to have you stand up. We're going to move this chair over, and I want you to walk to the back of the chair. And I'm going to have you have a seat back down. So we're going to inspect his posterior thoracic region. So his shoulders are symmetrical. There's no obvious deformities noted. No mass is noted. No mass is felt on palpation. And I'm going to palpate down his spinal process and let me know if you feel anything that hurts, okay?
Mm-hmm.
Does that hurt at all?
Mm-mm.
Good. So I'm going all the way down his spinal process. Good. No deformities noted. Everything looks clean, dry, and intact on his skin. Next, I'm going to check for CVA tenderness. So I'm going to percuss right down in the kidney region. Let me know if anything hurts or feels tender.
No. No.
Very good. Okay, and next I'm going to listen or auscultate your lung sounds all the way down. All right, take a deep breath in. Very good. Okay, I'm going to have you stand back up. And I'm going to have you face the camera anteriorly, so your chest is going to face the camera. I want you to sit back down. Good. So now I'm looking at his respirations, which are equal, even. I'm going to put my hands right here, and I want you to take a deep breath in and out. Alright, so his respirations are equal bilaterally, and they're symmetrical. No obvious deformities or deviations. So we'll begin by listening to your lung sounds anteriorly. So take a deep breath in, please. Good. His breath sounds are equal bilaterally and clear. Next, I'm going to take a look at your arms and I'm going to feel your joints, okay?
Mm-hmm.
So I want you to put your hand up a little bit. So his skin is clear, dry, and intact. His hair on his arms are evenly distributed bilaterally. I'm going to feel his joints. Does any of that hurt?
No.
Okay. I'm going to feel each joint. Good. And at the same time as I'm on this hand, I'm going to check for capillary refill. It's less than 3 seconds, which is completely normal. Put that hand down. Alright, I'm checking his joints in this left arm and hand. Good. No obvious deformities, his skin's clear, dry, and intact. And I'm also going to check his capillary refill in the left hand, which is completely normal within normal limits, less than 3 seconds. I'm going to feel, can you hold both hands up? On the dorsal part of my hand, his skin is warm, dry and intact, like I've been saying. And then I'm going to listen to his brachial and radial pulses, as well as his epitrochlear lymph nodes, which those lymph nodes you should not be able to palpate. So I'm going to have you raise your right arm, have you face it up. Okay, I'm going to feel for your brachial pulse, which I feel, and your radial pulse. Good. I'm going to have you shake my hand, bend that a little. Good. Okay, I'm going to feel for your epitrochlear lymph node, which I do not palpate. Alright, same with this left arm. We're going to palpate your brachial pulse, which is within normal limits. Your radial pulse, within normal limits. I'm going to shake this hand, and I'm going to palpate the epitrochlear lymph node, which I do not palpate. Okay, thank you. I'm going to have you extend your arms out, and I want you to act like you're catching a bowl of soup. Okay? So, flip your arms up, catching a bowl of soup, supination, pronation. Good. Okay, now I want you to put your arms by your side. Now I want you to flex them up. Good, and then hyperextend them back. Do it without bending. Straight, hyperextend them back. Very good. Next, I want you to rotate your arms in like that. Good, does any of that hurt?
No.
Okay, and then I want you to put them by your side and abduct them out over your head. Good. And then adduct them down by your sides. And then I want you to place your hands on the back of your head like you're lounging. Very good. So I just did examples of, you know what, actually, so that the camera can see it. Have a seat back in the chair and show that you can do that. So you can put your hands on the back of the head just so that they can see. Okay, good. So he did internal rotation, external rotation, supination, pronation of his arms. His shoulder range of motion is within normal limits. Next, I want to test your flexion and extension at the elbow, so like you're lifting weights at the gym. Good. Now I want you to flex those arms, and I'm going to try to pull, and don't let me. Good. Good. So his strength is equal bilaterally in both elbows and arms. Next, I'm going to do your wrists. So what I want you to do is put your wrist on your lap, okay, and flex it forward up. I'm going to hold your forearm, and I'm going to pull, and do not let me put your arm down, or hand down rather. Good. Same thing with this arm, flex it up, and I'm going to pull. Good, so his strengths are equal bilaterally. Now I want you to, let's see, we can have you put your hands straight, and I want you to extend them up, and then flex them down, like you're waving. Yep, good. Put your hands out, and I want you to do ulnar deviation, so your pinkies are going to go to your, good, so that would be your right. Yep, very good. Next, I want you to spread your hands out, your fingers out, good. Make a fist, good. And then I want you to touch your thumb to the end of your pinky. Nope, to the base of your pinky rather. Good job. Now both hands, do it with your left. Very good. And I want you to grip my fingers with your hands, so just be, as tight as you can. So his grip strength is equal bilaterally, and that completes this portion of the examination.
Cool.